Our next guest is Dr. Larry Mason of the Novant Health Inpatient Care Specialist, Brunswick. Welcome to the show today, Dr. Mason. It's such a pleasure to have you here.
Thank you for having me.
Well, great. I want to start by learning a little bit more about you. So tell me about your education and your background.
I'm originally from Florida, Titusville, Florida, Central Florida, and I graduated high school there, and I went to University of North Florida, which is in Jacksonville, Florida, for my undergrad. And then from there, I went to medical school in Grand Cayman Island at St. Matthew's University. And then from there, I did my training at New Hanover Regional Medical Center in Wilmington. And I took a brief hiatus back to Florida, did hospitalist work for 3 years, and now I'm back at Novant.
Now you're here.
Yeah.
So I understand you're new to Novant Health Brunswick Medical Center. And prior to coming here, where was it that you practiced?
Jacksonville. I was part of a 3-hospital group in Jacksonville, Florida. So I've been practicing there for the past 3 years, doing some medical directorship role and hospitalist work.
That's wonderful. Right. How are you enjoying it here at?
Oh, very much so. It was a easy, smooth transition.
Really?
Yeah, the team made it very easy for me.
That's great. Yeah, so I understand you have special training as a hospitalist, correct?
Yes, ma'am.
I know that we've had some hospitalists on the show prior to you, but I think it always helps to remind us about what a hospitalist really does. So let's tell our viewers about that.
Sure. Well, we have kind of specific training for inpatient medicine. So basically anybody that comes into the hospital is seen by us. The primary care physician turns over the care to us, so we can take care of them, with our the way that we do things in the hospital, allow them to remain in their office and take care of their patients that they're seeing on a daily basis. It also allows us to get in touch with other specialists that we may need that are rounding in the hospital as well.
So you see patients exclusively at the hospital, is that correct?
Yes, that is correct. So we take the patient in from the primary care physician, and we exclusively see them in the hospital. We do not do any outpatient primary care work, so we take care of them in the hospital, get them their acute illness treated, and turn them over to their primary care physician upon discharge.
Send them back to their home, their home practice.
Yep.
Well, I will be honest, I have heard some concerns in the community where patients feel like their primary care maybe not know what's going on. I know there must be a process by which you make sure that the primary care knows everything that's gone on. Tell me about that process.
Yes.
How does that work?
Certainly. So when patients come into the hospital, they get a initial history and physical that gets dictated, and that will immediately go to the primary care physician for them to see. So they'll know exactly why the patient's in the hospital. Also, we can always communicate with them by phone as well. And on a daily basis, we have progress notes that we do. They can also see them. And then upon discharge, there's a full discharge summary that gets dictated, that gets sent to the primary care physician so they understand exactly what has happened from beginning to end. And any Novant health physician can see it in real time on their computer as well.
Chart.
Yeah. So
that's a great tool.
Yes. Yeah.
So actually their primary care physician then is very involved through the transfer of information.
Certainly.
And what have you.
Because we can also see all what they've done on their end for the past months, years. I mean, I can read every single note that they've ever seen their physicians. So.
Well, that's interesting.
Yeah.
I know that there are several hospitalists at Novant Health Brunswick Medical Center. Tell me a little bit about your team.
Yeah, we roughly have about an 8-person team. We have 6 to 7 physicians, and we have 2 primary PAs that assist, the physician assistants that help us. So we roughly see around 40 to 60 patients a day. So that's basically the team.
That's a busy day.
Yeah, it's a good time.
So patients may see a couple of different hospitalists then, is that correct?
Yeah, we try and keep what we call continuity of care. So
Sure.
the one physician that sees them from the beginning, we like to have them, see them from beginning to end.
Mm-hmm.
So we like to kind of, not have, 5 different physicians seeing one patient at a time. So the way that our schedule is set up is we have a pretty long block of days that we work. So the likelihood of you seeing that physician the whole time through is pretty high. The only time you may get switched to another physician would be if we're going off our usual routine. And but then again, they'll see that next physician. That should be the one that they'll see for the rest of the time. So they should at maximum only
probably
see
2 at the most.
2. Well, it should only maximum see 2 different physicians at a time. So. Yeah.
Well, what about specialists like surgeons and urologists? Do they still visit their patients in the facility?
Certainly, they do. So we work hand in hand with the other specialists, surgical specialists, internal medicine specialists like cardiologists. They will all continue to follow along, and the more and more they get involved, the bigger our team gets, and we, have many physicians on one case. It's better for the patient,
right?
2 heads are better than 1. So,
always.
Yeah. So that's kind of how.
Always. Well, let's talk about day shift versus night shift. How does that information get communicated from the physician who's working during the day to the physician at night?
Sure. So we have a sign-out system that we use through our electronic medical records that we can dictate a full comprehensive sign-out on every patient. That can then be printed out, and when our night guy comes on, we all sit down together and we go through the list and make sure that there's anything major that needs to be followed up on, or if there's an acutely ill patient that needs to be watched closely, they will be informed. And then vice versa, they do their night shift, and then there's new patients that come on that we in turn get the sign out in the morning. So any critical care patient or anything like that, they will be seen immediately. And so the sign out system is very, very good.
I assume that you cover the ER also. When a patient comes through the ER that may need admitted, you would also handle that. Is that correct?
Sure. So typically the system, the way it goes is the ER doctor will call the hospitalist, and the hospitalist will come down to the ER and look at all the workup and deem the patient suitable for admission, bring them into the hospital, and run any further tests that we feel necessary. Continuation of treatment, whatever it be, antibiotics, so
great.
Other medicines. So,
Well, that's great information.
Yeah.
It's been a pleasure to have you here today. We're excited to have you as part of our team, and welcome to the neighborhood, so to speak.
Yeah.
Before we wrap up, is there anything else you'd like to add?
Well, I'm just appreciate it. Thanks for having me. And,
sure.
Novant has definitely been a great company to work for so far. So,
great.
Yeah.
Love to hear it.
Looking at doing great things, and it will continue to expand. So.
Well, thank you so much for coming. It's been a pleasure, and I hope to see you again real soon.